obviously today's a big day for you guys, vaccinating 50 people. How, since we spoke last week, how has it been just getting volunteers to participate in this trial?
Yeah, that's been an interesting part of this is we've gotten so much of an outcry for being vaccinated. We've had a huge number of contacts, and probably it's in the hundreds, certainly. The biggest issue has been explaining to people that they need to be patient and not try to get vaccinated now unless they're in the specific group that we're asking for. And so the reason we're asking for healthcare workers in particular, one is because they're on the front lines and they're the most likely to be exposed and infected. But also there's not, during these early times when we're trying to evaluate the vaccine and make sure that it works well, there's not enough production to do large groups. And we also have the issue of the funding for the trial. We're pretty much at our maximum. And so I got a contact yesterday from Missouri, and we had contact from Chile, so multiple states, multiple countries. India is wanting to do an additional group. And so it's kind of sad, the data is so strong for this that you'd want to say, oh, let's just vaccinate everybody. But there has never been done this type of trial. And so it's like the last step, but I think myself included, we're all impatient. So that's been the biggest problem, is we get hundreds of people wanting to be vaccinated. And then we have to go through and select out the ones that actually qualify. And in reality, the restrictions are pretty significant, right? The greater than 25 hours per week, direct patient contact time, or having direct interaction with COVID-19 patients. And so that's how we've constructed it to really get the most at-risk individuals first. And then as we open up later, if the data comes out good in the next few months, we'll go to other groups. But yeah, we've had a lot of responses, but I would say maybe only 30% are really, it's actually less than that. I mean, although I think a lot more qualified than could be vaccinated on the same day. That's another issue, right? There's a tight window of time when we can do it. We have to get a lot of people together to do the vaccination process. There's a lot of logistics. Even getting materials. And I don't know if I mentioned this last time, but things like alcohol swabs, right? If we're doing a vaccination, we want to sterilize the site. And so we had trouble getting alcohol swabs. So getting everything into the right place, getting the vaccine into the right place, getting all the people together in the right place, that was a very, very difficult task. There were a lot of people involved, and everybody's pulled together and get it done. So we do have sites in Bryan College Station, we have sites in Houston, we have sites in Temple, Round Rock, Austin, and Dallas. And so those sites are not going to do a vaccination yet. They're going to be a little bit behind us, but you can imagine for one site, there's a lot of things to do, but when you start talking about putting all those sites together, everybody has the same sort of issues that they're trying to address. So
is being asked in the survey for the people that are wanting to try and participate? Do you know?
I mean, we can actually go through it. It is just a survey, and it's very simple. It's online. It's a web page that's actually very secure, and that's one of the reasons we use this system. And so it asks for the date, asks for name, email address, phone number, date of birth, gender, and then the issues that I just mentioned, whether they're dealing with COVID-19 patients. And this one I think is something people make a mistake on sometimes. It's dealing with COVID-19 patients or 25 hours per week patient contact time. So some people that have a lot of patient contact time, they say, well, I've not actually dealt with a COVID-19 patient yet, so I don't qualify. But that would still be a yes. They would still qualify for that issue. And then it's, have you ever had BCG vaccine? And there's a lot of issues too, like allergies and any immunocompromised states, basic health issues, whether or not they have a cell phone, because a lot of aspects of the trial require having a smartphone, so you can respond to surveys in a timely fashion. And those are the main things. Yeah, those are the main things. So it's pretty quick. I think most people can probably get through that survey in about 5 minutes.
Yeah. And then for the ones that are participating, they are logging everything, correct? Is that how they are helping you guys with information?
Yeah, so they have weekly symptom logs, and these are all healthcare workers, so we're pretty confident that the information will be good from them. But if we have any questions, for example, one of the issues you might think would be not 100% clear is headache. Lots of people get headache, and it has nothing to do with COVID-19, but it has to do with duration. So if the duration is extended, then we would actually follow up and talk to them. With our clinician would call them, and so all of the health issues will be dealt with directly with our clinicians at the various sites, so that they're getting a very good assessment of their health throughout the trial. And we're also following their blood work, so we'll know whether or not they've been exposed. We'll also, if there's the potential for exposure, if we put together a few different factors to say, oh, this person might have been exposed, even though they don't have severe symptoms, we'll go ahead and test. And so we have all that set up, and we'll be able to say, okay, what type of response are they seeing? So it's a great detail that we're going to be following up each individual patient.
When we spoke last week, the vials for the vaccine, that's why testing, it needs to be in a short amount of time. So today there's 50 people. How many vials of the vaccine are going to be used?
That's all one. So one vial of vaccine can actually do as much as 50 subjects. And so we're not just doing 50, it's actually more than 50. We were shooting for 100 in this, and so we're somewhere between 50 and 100. I don't know where we ended up.
Okay, so one vial can do 50?
Yes, we'll easily do 100 or even 200. And so whenever we have a vaccine session, we'll only use one vial. And so that's really great, because we're not really impacting the stocks of the vaccine for this trial.
Are you guys getting responses in the bigger metropolitan areas? Are those responses higher than Bryan College Station, like Houston, Austin, Dallas? Are you seeing a difference?
Well, so we haven't really started recruiting seriously in Round Rock, Austin, Temple, and Dallas, and even Houston. The site in Houston, we don't have a date for vaccination, but it should be coming soon. And that's going to be Baylor College of Medicine probably first. And so MD Anderson will probably come right after that. And they may actually be at the same time, which is fine. But so we will send out announcements. The web page that we've set up for this has Bryan College Station, Temple, Round Rock, Austin, and Dallas in it. It doesn't have Houston on it yet, because we're waiting for that site to be set. But even without all of that, we've still probably, in terms of qualified subjects, had about 10 from Houston that have qualified in. And so what we're going to do is we're going to just transfer them over to that site. And we also now have, they can go once they qualify, they can select which site they want to be at. So we do expect to do another session of vaccination at Bryan College Station. So if subjects come in for that, but realize we're going to this is the only time we're going to do a smaller than 100 amount. We're going to do 100 next time, because this one is important for us to work out any issues that might arise in terms of processing and so on. So it's good for us to be on the low end this time, but next time we're going to wait. And so people may register now. Like I had at least one go through today this morning, and I know they're not going to be scheduled for today. So we're hoping in a week or two to have 100 in Bryan College Station again. So we'll do that as soon as we reach that threshold. We'll go ahead and do it, and the same for the other sites. So Houston, like I said, we have about 10. That's without recruiting. I'm sure as soon as we send out recruitment materials, we'll get a huge response there. Yeah, so that's the expectation. And same for Round Rock and Austin and Dallas. We've gotten contacts from them, maybe a handful already without recruiting. And I suspect, based on the numbers I've seen just for healthcare workers in the various sites, we'll have easily enough to max us out. So people should try to get in early. Otherwise, there will be some delay between as we get data. And so we finished the vaccinations, the maximum. We're going to do analysis of data, and then we hope to open up to more subjects after that. That's going to depend on the data, and it's going to depend on the funding.
And that's roughly about a 2-month process, right? Is what you're saying?
Yeah, yeah, that's my expectation. Is that's kind of 1 month is the minimum. I expect it'll take 2. Yeah,
okay.
At least.
And so, is there any other bumps in the road that you guys, other than what you said, that you guys have kind of had to deal with in the last week, just up to when you announced it to now?
No, I mean, everything has gone pretty well. We've gotten support from all of the institutions. It's been great to see everybody pulling together. MD Anderson has really worked hard to be able to ensure that we have the stocks of vaccine that we need, and that's been great. I don't know if I mentioned before, the bladder cancer groups have been very, very supportive. And you can see how they might say, oh, well, we don't want to give up stocks of vaccine. But no, they've been very, very supportive. We've actually gotten support all throughout the world. The various producers have all said that they're excited about the trial. They want to see what's going to happen, and they're willing to ramp up and produce additional stocks as needed. So it's been really heartwarming, I guess, to see all of the positive responses we get.
Absolutely. Well, thank you so much.